Hello, this is Dr. Stanley Lang. Welcome to this video, and the topic is how to prevent osteoporosis. And one of the things that comes to mind almost immediately for most people is whether or not you should be using calcium when you're trying to prevent osteoporosis. And that's because calcium has been recommended for many years. It's one of the questions we're going to try to address briefly. The second question is, how much exercise do I need? And a third and critical question is, does stress play a role in osteoporosis? And if it does, is it a big role or a little role? So the first question is, should you use calcium supplementation when you're treating osteoporosis? And the answer is no. Although the prevailing wisdom is yes, the reason that you don't want to use calcium is because it actually increases your risk for vascular disease, because calcium supplementation causes calcium to be deposited in your soft tissue. Now, this answer is assuming that you are paying attention to two critical vitamins. Number one, vitamin D, and number two, vitamin K2. So vitamin D, when you have adequate levels of vitamin D, what it does is it helps the body to absorb calcium very well from the food you're eating. So if you're eating a reasonable diet that has reasonable amounts of calcium in it, you don't need to supplement. Your body will absorb all the calcium you need from the food, and anything else that you happen to throw in as far as a supplement is only going to add too much calcium to the system, and the body will start to calcify your soft tissue. So if you're taking adequate amounts of vitamin D, which should be at least 5,000 units a day, then you don't need to supplement with calcium. In fact, you shouldn't. Now, the second thing here is vitamin K2. What does that do? Well, vitamin K2 is a vitamin that actually tells the body where to put the calcium. So vitamin D, among the many things that it does in the body, has an effect on the bone that it causes this protein to be developed that's called osteocalcin. And osteocalcin grabs calcium molecules, but it only grabs those calcium molecules if it's activated by vitamin K2. Unfortunately, more than 90% of the population in the United States is significantly vitamin K2 deficient, and we don't have very many good food supplies for it. I used to tell my patients to get it from food, but the more that I studied it, I realized that would be an inconsistent source for most people. And so in the last few years, I've been recommending vitamin K2 supplementation. So if you're going to supplement, what should you do? Well, there are basically two forms available for supplementation. One is called MK4, the other is called MK7. So what's the difference? Well, MK4 basically comes from food, from animal products such as butter, eggs, liver. MK7 comes from fermented vegetable products or other things that are being fermenting. Basically, the bacteria that are fermenting whatever the product is what creates the vitamin K2. The most rich source of the MK7 actually is a Japanese food called natto cheese, which is fermented soy. And from what I've heard, pretty bad smelling and pretty bad tasting, not likely to be embraced by the American population. So supplementing something that's got both MK4 and MK7 in it covers the bases much better than some of the products that are just MK7. Now, the people that promote just MK7 products will tell you that's all you need. And what I would tell you is that we don't know yet. There's multiple other subtypes of vitamin K2, and it's easy to get very high quality supplements that have both MK4 and MK7. And I recommend strongly to my patients that they use a supplement that has both. So how much should you be taking? Well, I recommend at least 500 to 600 micrograms a day, and that's quite a bit more than the current recommendations. But the Japanese have studied this a lot, and they've studied women supplementing with thousands of micrograms a day as a treatment for osteoporosis. So much higher doses, very safe, and it's very easy to get reasonable dosed MK4, MK7 supplements, and this basically tells your body where to put the calcium. If you don't have vitamin K2 on board, your body does not have direction as to where to put the calcium. And you want to put it in your bones and in your teeth, and you want a little bit available for the chemical reactions in the body, but you don't want to be putting it in the soft tissue. Vitamin K2 also activates a critical protein in the soft tissue, which is called matrix GLA protein, and most importantly, it's in the arteries. So basically, it repels calcium from depositing, and that's why it's critical that you're taking vitamin K2 if you're taking vitamin D. If you're taking vitamin D and not supplementing K2, you're creating a new problem, which is that you're taking the calcium out of your food efficiently. You've got good levels in your blood, but your body doesn't know where to put it, so it's going to put it everywhere, including your soft tissue. Now, the last thing I mentioned in terms of questions is, what about stress? Well, there's very significant research that shows that chronic stress triggers or aggravates osteoporosis. Now, it's probably because of its effect on cortisol, but we don't really know all the mechanisms that are part of chronic stress. And so I strongly encourage that my patients always engage in a comprehensive stress reduction program, no matter what their problem is, whether it's osteoporosis or diabetes or heart disease or depression. It doesn't matter. The stress plays a huge role in making all of those conditions worse. Finally, what kind of exercise should you be doing? You should be doing weight-bearing aerobic or cardiovascular exercise and a strength program. Some people would say just do a strength program, and I would say, well, a strength program, if you've only got time to do one type of exercise, you should be doing a strength program. But a strength program combined with a weight-bearing cardiovascular exercise, which can be as simple as a vigorous walk, is more effective in my experience. And I have had many patients who have reversed their osteoporosis simply with these natural means and have built bone, which we've demonstrated over years of monitoring the bone density. So you can definitely build bone without medication if you're doing everything right nutritionally. Now, there's a lot of other micronutrients that are helpful, which I haven't touched on, but the key ones are vitamin K2, vitamin D, and I didn't mention magnesium. But there's some other micronutrients that are even not as important, but are important and should be considered. So the question is, what should I do about this stress effect with osteoporosis? How big of an effect is it? Well, we can't measure its effect in any one person, but I can tell you that chronic stress affects everything in your body in a negative way. And so I strongly encourage patients to do what they can to take care of chronic stress or to address it if at all possible. And I believe that the best way to do that is with a whole person health approach, which we call health of body, mind, and spirit. And so I recommend this kind of a strategy when you're trying to deal with chronic stress. And if you're interested in this and you want more information, please click on the link below this video. It'll take you to some additional information. And if you're not interested, at least take the vitamin K2 and the vitamin D with your vitamin D, and then also extra magnesium. That's sort of like the foundational cornerstone that you need to do. But all these other things do play a significant role. And when you do all of it, you can build bone and not need to use medication. So I wish you well, God bless, and have a great day.